Welcome back to Our Issues Milwaukee. I'm your host, Andrea Williams. September marks National Suicide Prevention Month, an annual observation dedicated to increasing awareness of and action around suicide prevention. My next guest is Martina Gollin-Graves. She's the president and CEO of Mental Health America of Wisconsin. How are you, Martina?
I'm well, thank you.
Thank you for being here. Tell us a little bit more about Mental Health America of Wisconsin and what it is you do.
Yeah, we're a statewide prevention and advocacy organization. We support more than half of the 72 counties in the state around suicide prevention, and we have direct services here, like an outpatient clinic here in the Milwaukee area.
That's awesome. So we look at suicide statistics. It's estimated in 2017 that nearly 1.4 million people attempted suicide, while over 47,000 actually died by suicide. So scary numbers and very sad, of course. The rate of suicide happens to be the highest in middle-aged white men, but suicides committed by black men 65 plus are very similar to that of white men. So your organization is raising awareness around minority health and suicide prevention in the urban community. If you would, fill us in on that.
Thank you. That's correct. Unfortunately, for a long time, we talked about suicide and suicide deaths as other people's issues, and it's coming home in black and brown communities. And so over the last few years, we've seen an increase in black and brown suicides right here in Milwaukee County.
Wow.
So last year, our deaths in Milwaukee County, suicide deaths, were the highest that they had ever been, and we've seen a steady increase in both white, but interestingly in black and brown suicides.
So have you guys had an opportunity to kind of figure out the reasoning behind that rise in numbers?
You know, we can only speculate, and I don't say this flippantly, but unfortunately the people who die aren't here to tell us why. We know that men are more likely to complete suicide, and women are more likely to attempt. And that is similar with across all minority groups.
So there's also a situation, I'm guessing, with people having less access to services for uninsured individuals, so uninsured and underinsured.
Correct.
And then also just the amount of trauma that a lot of people associate with being in the urban community in itself.
So I think some of the issues around poverty and around unemployment, around the high incarceration rates. So we're seeing an increase in African American males, older adults, 65 and older is where we're seeing the highest increase in African American male suicide deaths. So I think it's a compilation of the stressors that minority folks are embarking upon every single day. And now it's starting to hit home, and people are unfortunately taking their own lives.
Yeah, and you did mention that you guys have an outpatient clinic for mental health and substance use disorders with culturally responsive clinicians and staff. That's really an important thing to highlight. Talk about the importance of having individuals there who understand those somewhat unique circumstances.
We've really worked hard as an organization to be able to respond to the needs of an urban community. And so that certainly means having clinicians who have a certain perspective and who are able to think about how best to support not only people of color, but we're talking LGBTQ, we're talking single mothers, we're talking young men who are experiencing trauma every single day. So again, responding to urban issues, especially around substance abuse disorders.
And you guys have a suicide prevention specialist that's on hand. So if you would give us the website address and a phone number where people can get more information and take advantage of the programs and services that you do offer.
Yeah, so we do have a suicide prevention specialist, and people can find out more about all of our programs at www.mhawisconsin.org, or they can call our office at 414-276-3122.
All right, so you're going to be holding your annual meeting luncheon in December.
Yes.
And that's where you're going to also be welcoming a new board chair. So this is an exciting thing for you, I'm sure. So you've got Pastor Greg Washington, who will be the first African American board chair ever in your organization's 89-year history. That's a pretty big deal. So if you would kind of fill us in on who he is and what he brings to this organization.
I'm so excited to have Greg be our incoming board chair, and part of that is because he self-identifies as a person with lived experience. He lives with depression and anxiety, and he has used his platform as a pastor to talk about mental health issues in the Black church and in the urban community. But his message is so universal, and so it's just really a time when we can spread the message that this is everyone, not just certain populations.
Yeah, it's true. It is affecting people all across the board, and it's unfortunate, but this is one of those subjects that just doesn't get talked about enough, which is why I have you here today. So MHA has a suicide prevention task force as well. How do they work?
We don't, actually that's not our task force. It's a statewide task force led by Representative Joan Ballweg.
Okay.
And so they've been traveling around the state, and we've been able to give some testimony and input about what we'd like to see happen legislatively and with resources and such in the state of Wisconsin.
Okay, so it's something your organization is actually working as a collaboration, which is so important because we always talk about the importance of collaboration and how different organizations and individuals bring different experiences and expertise to the table. So what have you been able to share with this task force?
We've talked a lot about common sense gun laws. We've talked a lot about needing resources to expand a lot of the programming that prevents suicide. And I think that's the conversation as a community, as a state, which is why I'm excited about Greg and our organization. We talk about issues in terms of prevention, not at the back end.
Okay, well, thank you so much for taking the time to come by, remind all of our viewers of the great things that you're doing at MHA, and I encourage everyone to definitely take a look at the website and help spread the word.
Thank you for having me.
Thank you, as always, for coming by. Martina Gollin-Graves is the President and CEO of Mental Health America of Wisconsin. For more information on anything that we've discussed, you can visit their website at mhawisconsin.org or give them a call at 414-276-3122. That's going to do it for today's show. I'm your host, Andrea Williams, as always. Thank you for watching, and I do hope you join us again next week as we take another look at our issues in Milwaukee. Have a great day.